Okay, so today we are going to be talking about elbow injuries. But before we get started, we're going to look at the elbow joint and the anatomy and the physiology of the elbow joint. Okay, so the first thing about the elbow joint is it's a hinge joint. So if you think about your door, think about a hinge on a door. What does that do? It basically opens and closes the door. So because of that, the elbow joint can really do one or two different motions. You can either flex your arm, flex your forearm, or do extension of the forearm. So some books will say it does pronation and rotation. So I threw that in here, but let's take a look. And this is looking at my elbow joint. So you can see if I do flexion, I'm going to start from here and I'm going to bring my palm up towards my face. That's flexion. If I do extension, I'm bringing my palm away from my face. Those are the two main functions of the elbow joint. But like I said, some books will say pronation and rotation. So your elbow's up here. You can see your palms up, and all you're doing is putting the palm down. If a simple way to remember this is for supination, if you put both your palms together face up, you make almost like a cup, like you're looking for soup, or you can pour soup into. That's supination. And then pronation is when it's face down. Now, if you notice, you don't see a whole lot of difference in the elbow joint down here. So let's go ahead and take a look. Now the elbow joint is going to consist of the humerus, this is your arm bone, and then the radius and the ulna. The radius and the ulna are the bones that are in your forearm. When you do pronation and supination, they will cross over each other. Your radius is on the side of your thumb. Your ulna is on the inside, on the side of your pinky in the forearm. So if we take a look here, once again, this is my humerus right here. And this is going to be the arm bone. So my biceps muscle would actually be right up in here. This is my forearm down in here. And like we said, the forearm is made up of two different bones. It's made up of the radius and it's made up of the ulna. And to give you an idea what you're looking at, if you were to look at the front of your elbow, you're looking at basically this whole area in here. Now, if you also look, you can see that there is a bump that is right. One second. There is a bump right here. This is my medial epicondyle, which we're going to be talking about in a little bit. But this is my medial epicondyle. Over in here is my lateral epicondyle. So my lateral epicondyle is going to be over here. It's on the outside of my elbow. To give you an idea, if you feel the bump on the inside of your elbow, what you're feeling is this bump right here. So in tennis elbow, we are going to get inflammation of the outside or of this epicondyle that's out here. And we're going to be talking about that in just a minute. Okay, so the first condition, like I said, we're going to cover is tennis elbow. It's also known as lateral epicondylitis. Remember, whenever you see the word itis at the end of a word in medicine, it means inflammation. So here we're going to get inflammation of the lateral epicondyle. So going back and explaining again, there's bumps that are on either side of your elbow called epicondyles. The epicondyle on the lateral side of the elbow is called the lateral epicondyle. So let's just go back and look at it real. And remember, it's right here. This is my lateral epicondyle. That's right here. Okay, now there's tendons that are attached and muscles that are attached in the forearm that attach to the lateral epicondyle. So you have tendons coming from the forearm that attach to the lateral epicondyle. And the most common muscle or tendon involved in tennis elbow is the extensor carpi, means wrist. So it's the extensor carpi radialis brevis. So what it's saying here is that this is going to extend the wrist. So if you were to look at the back of your hand, and now you're going to bring the back of your knuckles toward your head, toward your face, that's extension of the wrist. Okay, if you're looking at your palm face up, move your palm away from your face. That's going to be extension. Carpi means wrist. So this is saying it extends the wrist. Radialis, if you remember, we just studied the radialis bone. Remember, it was this bone right here. That's the radialis bone. Okay, and brevis. So that means it's a short muscle. And if there's a radialis brevis, that means there's a radialis longus. So right now we're interested in the radialis brevis. So it's going to come up and basically connect from the radius to the lateral epicondyle. Okay, and what does it do? It stabilizes the wrist joint when the elbow is straight. So let's take a look at this muscle real quick. Now, if you notice, this is our muscle right here, and it's attaching onto the medial epicondyle. And like we said, it's going to stabilize the elbow when the elbow is straight and the wrist is straight. You can see that this is part of a tendon that's going all the way down here too, but we're interested in up here. As someone goes to hit a tennis ball, the tendon that's up here, which is, they don't really show a whole lot of it, is going to rub over this medial epicondyle and become inflamed. And then what will happen is it will cause, after a while, it'll have micro tears, and after a while, it will start to cause pain. So like we said, so the most common muscle involved in tennis elbow is the extensor carpi radialis brevis, and it stabilizes the wrist and elbow when the elbow is straight. When someone does a ground stroke in tennis, the elbow and the wrist are straight. As the elbow bends and straightens, the muscle rubs against the lateral epicondyle, and over time you get micro tears in the muscle and the tendon, which is going to lead to pain. So let's take a look at a ground stroke. So even though it says muscle, it's going to be the muscle and the tendon. So this right here gives you an example of a ground stroke. If you notice, the tennis rackets face towards the ground. And then what's going to happen is, as this person hits the ball, they're going to come around this way, and they're going to rotate the elbow over this way. And what that will do is that will cause that extensor carpi radialis brevis to rub on this joint right here, on the lateral epicondyle, and cause micro tears. Let's take another look. Okay, and I think this is Roger Federer. He's actually a professional tennis player, but you can see the elbow is straight right here. So the elbow straight, the extensor carpi, and the wrist is pretty much straight. The extensor carpi radialis is stabilizing this here. So once again, once he hits this ball, he is going to follow through, and as he follows through, he rotates this over, which is going to put stress on the extensor carpi radialis brevis right up in here. So that's the causes of tennis elbow. So here's the treatment of tennis elbow. Like so many sports medicine injuries, it's simply rest, which rest means you don't play tennis for a while. You put ice on it after using it. Compression means you can do compression on the with the ice on the area, and then you keep it elevated to prevent any inflammation. And remember, it's got to be elevated above the level of the heart. So we're trying to get the inflammation down. You want to make sure that you warm up the elbow before use, and then you got to do cross friction massage. So cross friction massage, what that is the tendons in the elbow are going this way, right? And then we get our little tears like this. So when you're doing cross friction massage, you're going back and forth over this area like this. Even though the fibers of the muscle are going this way, you are massaging going this way. And that's cross friction massage. And then you can do an elbow brace. Very seldom would this require surgery. It's just a matter of letting it rest. And remember, rest, ice, compression, and elevation. And that is it for tennis elbow.